So if some of the other things, flexion or extension-based exercises really aren't helping, and you have that pain that's real low down on your hips, right kind of at those dimples on your low back or where those bony kind of bumps are on your low back. So that's called the SI joint. And in that region, if you've got pain right around there, sometimes this can be really helpful at helping to reduce or eliminate that type of pain. So what you can do is actually see which side you want to do this exercise that we're going to use a stick for. What you do is you lay down, and especially if you find that you feel like you're walking crooked or one leg is longer than the other, if you've ever been told that, or you feel like you're kind of leaning to one side, this can be really helpful. So you want to look and see if one leg looks longer than the other. Sometimes you have to kind of sit up and see, or you can have a friend come and as you lay down, have them look at your feet and see. But if one leg is a little bit longer than the other, that helps give you a clue. If not, if you're not sure, but you have that low pain, you may try this and see and just try both directions. But once you find which one relieves the pain, you only want to do that one direction. And so let's say if my right leg was slightly longer, it doesn't mean it's permanently longer. It just means that the bowl of your pelvis is kind of tilted in that direction because of some muscle imbalances. So we want to activate those other muscles, use those other muscles to help balance that back out. So what we're going to do is we're going to take this stick. If this was the longer leg, what we're going to do is you put the stick in between so that you're pulling up with this leg and pushing down with that leg. So the stick's going to want to do this, and you're holding that with your arms, and you're going to do that 10 times for about 5 to 10 seconds. You're going to push fairly forcefully and hold and then relax and push and hold and relax and push and relax. So I'm just using a wooden dowel. You can use a broom handle, really anything sturdy enough to withstand it. Anyway, once you're done with that, if you test again, you should see that your ankles line back up, that things have evened out. And when you get up and test it, walk around, do that pre-test, post-test where you slide your hands down your thighs, should have a little bit more motion and it shouldn't be quite as painful. Then you're going to want to do this several times a day, 5 to 6 times a day. You really can't do it too much at this point.